All right, so let's go to microbial diseases of the nervous system. Today, we are going to explore how microbes invade and disrupt the nervous system, one of the body's most protected environments. These infections are rare, but often devastating due to the central nervous system's limited regenerative capacity. So once it's damaged, it's hard to regenerate. So let's begin with the anatomical barriers microbes must breach. So let's start with meningitis. So meningitis caused by the meningitis is a medical emergency. Key virulence factors include number one, capsule and pili. Evade phagocytosis and attach to the nasopharyngeal mucosa. Number two, the IgA proteases destroy secretory antibodies on mucous membranes. Number three, iron binding enzymes. Still host uh, iron. It's a still host iron for bacterial growth. Number four is endotoxin or LPS. Strain B and C are hypervirulent due to potent endotoxin, triggering septic shock. Clinical Pearl UT's recent outbreak involved strain C, always considered meningococcus in young adults with fever plus rash plus neck stiffness. There's that. So, mode of transmission, it could be respiratory droplets. Mm, Those are the symptoms: fever, stiff neck, headache, sometimes rash, but not too alarming at first, but can rapidly progress to convulsions and coma. Rapid diagnosis is essential, so antibiotic can be given before CNS damage is too severe, because once again, it's a part of our body that is so hard to regenerate. Vaccine is available. This is not that effective, especially with children. And we have more. Um, Listeria. Oh, we get there now. Okay, let's go now to the next one. The Listeria monocytogenes. Listeria monocytogenes. Listeria is a foodborne threat to pregnant women, elderly, and immunocompromised. It crosses the placental barrier, causing fetal death. So outbreak example is in the 1970s in LA County, linked to unpasteurized Mexican goat cheese. So why concerning? Grows It grows at 4 degrees Celsius, meaning refrigeration doesn't kill it. Gram-positive rod that mimics Corynebacterium on slides. All right. Next is the botulism by Clostridium botulinum. Botulinum. Botulism is an intoxication, not infection, the most potent natural toxin known. So for the mechanism, exotoxin blocks acetylcholine release at neuromuscular junctions that leads to flaccid paralysis. Um, Boiling destroys toxin, but not the spores. So It has three forms. Number one, foodborne from canned goods, and this can be fatal. Number two, infant, floppy baby syndrome from spores in honey. Number three, wound, sugat, rare but mimics. C, perfringens. Treatment, antitoxin for adults and supportive care for infants. Antibiotics may worsen toxin release. Prevention, never use bulging dented cans. Tetanus. Okay, let's go to tetanus by Clostridium tetani. The tetanus toxin causes hepatic paralysis. Um, Key points: neurotoxin inhibits inhibitory neurons that leads to uncontrolled muscle contractions like lockjaw. Soil spores enter deep wounds. Um, it could be through rusty nails. Treatment: human tetanus immunoglobulin or HTIG neutralizes toxin. You can also have vaccine. Toxoid vaccine is highly effective. Boosters every 10 years. Let's go to rabies. Rabies is 100% fatal once symptoms appear, but 100% preventable with post-exposure prophylaxis or PEP. Pathogenesis. Viral travels retrograde from bite site to central nervous system via peripheral nerves. This is weeks to years. PAP protocol or post-exposure prophylaxis. Number one, wound cleansing with soap and iodine. So if you got bitten by an animal, you wash it. Rabies immunoglobulin injected at wound sign, and a vaccine series from day 0, 3, 7, 14, and 28. Prevention, pre-exposure vaccines for veterinarians, and then oral vaccines for wildlife, like the Texas coyotes. Red flags, nocturnal animals active in um, daytime. Like, okay. Next, polio. Polio's asymmetric paralysis shaped modern virology. Key facts is fecal oral transmission, enterovirus, and it destroys motor neurons that leads to permanent paralysis. We have vaccines for this. One is the SALK, or IPV. This is an inactive virus safe for infants. We all have another one, the Sabin, live attenuated. Uh, well, for eradication, WHO, or World Health Organization, targets polio as the next smallpox. Cases persist in, but there are still cases persist in some of the part of Afghanistan and Pakistan. Okay, let's go to fungal infections. Um, Cryptococcal meningitis. Cryptococcus neoformans thrives in pigeon droppings. Diagnosis: India ink stain of CSF shows encapsulated yeast. Antigen is gold standard as well. Treatment is use of amphotericin B plus flucytosine for induction, and fluconazole lifelong for HIV patients. Why challenging? Slow progression of it delays diagnosis. Arbovirus. Okay, arbovirus. Arboviral encephalitis. Now, West Nile virus or WNV is now endemic in Texas. Clinical features: high fever, headache, and flaccid paralysis. Um, Reservoirs from bird to mosquitoes to human. Prevention: mosquito control, like drain standing water, off lotion. And then no human vaccine exists at the moment. Mm. Okay, Prion disease. Prions are misfolded proteins causing spongiform encephalopathies. Examples: Kuro, Kuru, four tribes cannibalistic rituals, and then human variant of mad cow disease. Pathology: no nucleic acid, infectious via protein conformation. Spongiform degeneration of brain tissue. For diagnosis, it needs brain biopsy. To recap, bacterial meningitis, botulism, and tetanus require rapid intervention. Viral, like rabies and polio, are preventable with vaccines. Fungal or prion diseases highlight diagnostic challenges. So for critical takeaway, the nervous system's immune privilege makes infections rare but catastrophic. Always consider epidemiology, like travel, animal exposure in diagnosis. Thank you very much, and that's it.